Hi, this is Dr. Silvester, and I'm happy to announce that our office has been selected to be one of about 20 places in the country that are HyProCure Centers of Excellence, and I'm going to tell you a little bit about what that means. What it means is that we've met certain qualification criteria in order for the company to approve our office as a place where we've done enough of the procedures and have met certain testing criteria, and also the office has met certain criteria to achieve this status of being a center of excellence. What the HyProCure implant is for people that have poorly aligned feet. We have every day patients that come into our office that have poorly aligned feet, and that's not what they come in for. What they come in for are painful conditions that are the result of having poorly aligned feet. For example, they might come in with heel pain or tendonitis or chronic postural fatigue or hammer toes or a bunion deformity or things like that that are kind of the secondary complaint or the secondary manifestation of a poorly aligned foot. And so we can usually treat those conditions. We can treat them and make them feel better and get their comfort level back down to where they want to function. But the problem is it's kind of like having a flat tire and just putting air in the tire. It's not the same as fixing the tire, fixing the flat, and then putting air in the tire to allow it to function more normally. Well, what the HyProCure implant is, I'm just going to show you. I have a little skeleton device here that I'm going to show you. And what it is, it's a small little implant. It's this size, not very large. And it comes in a few different sizes depending on the foot. And we put the device inside the subtalar joint, and it's actually outside of the joint itself, but along in an area where it's not implanted into the bone or anything. And what it does, it just stops the foot from being too far pronated, what we call in podiatry. And what that is where the forefoot everts, the arch collapses, or the ankles cave in a little bit. If you want to test yourself, you can stand in front of a mirror, draw a line down the front of your leg, and then draw a line to your second toe, up your foot, up the second metatarsal, and see how your foot lines up. If everything is fairly straight, then that's a pretty normally aligned foot. If you have eversion of your forefoot where the second toe is pointing outwards, then that's a poorly aligned foot, and there are things that can be done for that, and one of those is the HyProCure treatment. We have the option of putting it in the office because we've become a center of excellence. We also have the option of doing it at the hospital if you so prefer. We have a significant number of patients that have problems with poorly aligned feet, and most of them, when they come in, they're not even aware of it. They come in and they say, well, you know, I've got this problem, and we point out that that problem is the result of a poorly aligned foot. Poorly aligned feet can also cause a lot of problems with the knees and the hips and back, and so other conditions we've found that when we treat their poorly aligned feet, a lot of their other complaints of their lower extremity and back seem to go away as well. But we're very pleased with our designation of being one of, right now, about 20 places in the United States that are HyProCure Centers of Excellence, and we look forward to providing this service to our patients in a way that provides them with not only solving their foot pain problems, but also solving the problems that cause the foot pain.